In this video, we will discuss the pulse as a vital sign. As said previously, your pulse is a representation of your heart rate, or how many times your heart is beating per minute. Like blood pressure, this value is not static. It is always changing. It is also important to consider the heart rate in relation to blood pressure. Let's start by talking about the various pulse sites. A pulse site is an area in the body where an artery runs close enough to the skin to allow you to palpate or feel a heartbeat. When you palpate your patient, you place your hands on their skin and apply a subtle pressure in order to assess for a response. When assessing for a pulse, you want to apply your first two fingers over the pulse site and apply a gentle pressure to feel for the pulse. Avoid using your thumb to check your patient's pulse, as it contains its own pulse, and you may confuse your pulse with the patient's pulse. The most familiar pulse site to many people is the carotid pulse. The carotid pulse exists at the location of the neck at the carotid arteries. This pulse site is also closest to the heart and helps to assess for the presence or absence of a heartbeat altogether. Thus, when you approach a patient who is unresponsive or not breathing, check for a pulse at the carotid artery for just under 10 seconds, and if no pulse is felt, begin CPR. Next to the carotid, the radial pulse is often well recognized. This is the site on the lateral aspect of the wrist where the radial artery passes underneath the wrist retinaculum. This is the most accessible location to assess a pulse on a conscious patient. The radial pulse site is a common pulse site in adults, but in young children or infants, it is easier to assess for a pulse at the brachial pulse site. This site is located on the medial aspect of the brachium, under the biceps muscle where the brachial artery exists. This is a deeper site and may require additional pressure to feel the pulsation of the artery. The femoral pulse site is another large artery pulse site, like the carotid, but less often checked due to its location in the groin. The femoral pulse site can be found in the inner thigh, mid-inguinal point, between the pubic symphysis and the anterior superior iliac spine. During cardiac arrest, the femoral pulse may be used to assess the quality of cardiac compressions. If a pulse is felt with each manual compression, the compression is of good quality, and the resuscitation effort will be more effective. Lastly, two pulse sites exist on the foot. The dorsalis pedis pulse exists on the dorsal and medial aspect of each foot and in the area of the first and second phalanges. The posterior tibial pulse exists on the posterior medial aspect of the ankle, behind the medial malleolus. The pulse sites at the foot are useful in assessing perfusion to the lower extremities. This is helpful when considering an arterial blood clot in the leg or to compare equal perfusion to both feet in the setting of an injury. Comparing bilateral perfusion is helpful in the upper extremities as well. When considering any arterial pathology like an aortic dissection, aneurysm, or clot, comparing bilateral pulse sites will help to determine if one area of the body is not receiving blood flow. Pulse sites may also be used to estimate a patient's blood pressure. If a radial pulse is present, you can estimate a patient's systolic blood pressure to be greater than 80 millimeters of mercury, because it takes that much pressure for blood to flow and make it all the way to the radial artery. Absence of a radial pulse in a patient indicates hypotension and may be due to an acute illness or injury. If the radial pulse is absent, but the femoral pulse is present, the systolic blood pressure can be estimated to be above 60 millimeters of mercury. And lastly, if just the carotid pulse site is present, the systolic pressures may only be just above 40 millimeters of mercury. We encourage you to check a pulse nearly immediately upon interaction with your patient. Doing so will help you, the EMT, determine whether your patient falls into the sick or not sick category. Here's a tip. Just after introducing yourself to your patient, mention to them that you're going to check their radial pulse while you continue to talk to them and gather a patient history. While feeling the radial pulse site, you should be assessing for the sensation of a rapid or slow rate, whether the beats are occurring regularly or irregularly. And you should assess the quality of the skin at the wrist, whether it is warm or cool, dry or moist, and whether this wrist is swollen or thin. After gathering a few basic indicators right away, then continue to count the number of beats in 10 to 15 seconds. The longer you count for, the more accurate your calculated heart rate will be. If you count for 10 seconds, multiply the beats counted by 6 to get the total beats per minute. If you count for 15 seconds, multiply the beats counted by 4. And to repeat, if no radial pulse is appreciated, take another look at your patient and consider that an emergent condition is present and prepare for rapid treatment and transport. Getting an accurate blood pressure at that moment is advised.